Hi friends, welcome to my new video. Today we are going to discuss about a symptom called as dizziness. What are the major types and what are the major causes for this dizziness and the difference between and the treatment methods. So today we are going to discuss about this. Don't skip this video. Let's go.
I played it innocent, a feel of discontent. I'm finally facing it all, fearless.
Before going to discuss about the major causes for this dizziness, let me discuss about the major difference between dizziness and vertigo. In vertigo, mainly you might be feel like you are in a spinning or floating manner, and you may be feel like whether you are in tilting motion and swaying motion. But in dizziness, you may be feel like whether you are in fainting, and you might feel like lightheadedness, and mainly after lightheadedness you might feel like whether you have nausea. So these are all the major difference between this dizziness and vertigo. What could be the major causes for dizziness? The first common cause is if you have BPPV. BPPV mainly indicates if you have benign paroxysmal positional vertigo. It mainly occurs when you change your position of your head or position of your body to another side. So in this manner you may felt a dizziness for few seconds, from few seconds to few minutes. How it will be occur? It mainly occurs due to if you gone for any head injury and also if you are aging older. So these are all the major causes for this BPPV, and it can be corrected by a CRP procedure. So in this procedure mainly it will be helpful to remove or positioning the crystals. So in this manner we can prevent or we can correct this BPPV and you can prevent from your dizziness. So this is the first common cause for this dizziness. And the next common condition for the occurrence of this dizziness is if you have Meniere's syndrome. Meniere's syndrome, in the sense there will be too much accumulation of a fluid in the inner ear that will cause symptoms like hearing loss, tinnitus, distorted hearing, nausea and vomiting. And this may be last for 20 minutes to up to a day. So it will be seen in people who are aged in between 40 to 60, mainly old aged people. And it will be controlled, it can be controlled by limiting your salt intake, mainly salt diet, and the next thing is avoid smoking and alcohol. And some medications may also cause this Meniere's syndrome. So if you control the medications, you can control this Meniere's syndrome. So this is the second common cause for this dizziness. And the next common cause is if you have any ear infections. Ear infection in the sense which may be bacterial or viral, that may affect vestibular and cochlear nerve. Mainly this vestibular nerve will be helpful to send signals about balance, and cochlear nerve will send signals about your hearing. So if these nerves will affect, that will also cause this dizziness, and it can control by going for a proper consultation, and you can prevent and you can avoid this dizziness. So the next common reason or the third common reason is if you have any infection, mainly bacterial and viral infections. And the next common cause is if you have any kind of diseases related to your heart and brain. For heart mainly it will occur due to a disease or condition called as arterial fibrillation. And arterial fibrillation mainly your heartbeat will be irregular, and the next thing is if you have hypotension, that means low blood pressure, and the next thing is if you have atherosclerosis. So these are all the major causes related to your heart that may also cause the dizziness, and next thing is related to your brain. If you have any traumatic brain injury or if you have any condition like migraine, that may also cause this dizziness. So these are all the system-wise causes for this occurrence of dizziness. And the last common cause is related to your activities. Mainly if you are addicted to alcohol, you may also get this dizziness. And the next thing is if you have anxiety and stress. And the next thing is if you have low blood sugar level, that means hypoglycemia. So these are all the major causes for this occurrence of dizziness in your day-to-day life. So mainly I will classify, I classified about your ear related to your ear and ear infections, and your heart related to heart, brain, and your other social reasons. So these are all the major causes. So how to treat this dizziness? Mainly you have to treat your underlying causes. By treating these underlying causes, we can avoid this dizziness. So you have to go for your nearby doctor or nearby ENT doctor to prevent these complications. So that's all about today. Next day I will reach you with another topic. Thank you. Have a nice day.